pelvic radiation for cancer treatment, it's important to stay active. Keeping your hips and your pelvic floor muscles mobile can help prevent issues like stiffness, pain, and decreased range of motion. In this video, I'll guide you through 3 simple exercises to do during and after pelvic radiation treatment to keep you feeling good. I'm Dr. Alex Hill. I'm a board-certified pelvic health and oncology physical therapist. Make sure you subscribe for more videos on pelvic health and cancer care for your survivorship journey. Before we begin, please remember to always check with your medical provider first before starting any new exercise routine, especially during cancer treatment. If you feel any pain during these movements, stop immediately. And bonus points to ask your provider to refer you to a pelvic health or oncology physical therapist for ongoing personalized support throughout your cancer journey. All you're going to need for these exercises is a comfortable place to lie down, whether that be on your bed or on the floor with a yoga mat, towel, or blanket. We are going to be moving our legs a little bit, so a couch may or may not work for you depending how wide your couch is. The first exercise we're going to do is rotating the hips in and out. These are sometimes called windshield wipers. So you're going to keep your knees straight for the entire movement. You're going to bring your legs wider than your hips, and the movement really comes from your hips. So you're going to be rotating in so that your knees and your toes are facing each other, and then you're going to rotate out. So we're going to do about 10 of these. So go ahead and rotate all the way in and rotate all the way out. When you're first starting out, you may find that you need to start in a smaller range, and that's okay. Just do what feels good for your body. And oftentimes, as you're doing more of these, you'll start to feel that your hips can do even a little bit more movement in each session. If that's the case, then you can bring your legs a little bit wider apart and then rotate in from there and then rotate out. And we're not forcing anything. We're just doing what feels good with our body. And something else that can feel nice is doing your breathing with the movement. So you're going to breathe in as you rotate in, and then breathe out as you rotate out. Breathe in as you rotate in, and breathe out as you rotate out. This should feel like a nice relaxing movement. You shouldn't have any pain with this, and you want to keep your knees straight. You don't want to lock them out, but you don't want to have them bent to get into that range. So we'll do 2 more. So we're going to rotate all the way in, rotate out, and we want nice slow movements with this. The next exercise, you're going to bring your knees up and towards your chest. You don't have to bring them all the way up, but you do need to bring them up so that they're off the table or off the bed or the floor, whatever you're lying on. And we're going to support our legs with our knees, and we're going to be doing circles. So you're just in a small movement, rotating your hips in a clockwise movement. And we're doing this again about 10 times. You can do 10 to 15 times. And as you do this, you want to feel that your back is moving, your hips are moving, and that you're staying nice and relaxed. And you can, as you do this, get into some deeper ranges, some bigger circles as you do this, and as things start to feel better. And this is going to be the first part of this movement, is just doing these big hip circles. And then you're going to go counterclockwise. So then you're going to go back towards your chest and out. And just like with the first exercise, you can do this with your breath. So you're going to breathe out as you come towards your chest, and then breathe in as you come away. Breathe out coming towards your chest, and breathe in going away. So as you come in towards your chest, it's really like you're kind of squeezing that air out and then filling it up. And as you do these, again, working towards bigger circles to what feels good for you. And then after we do both movements, clockwise and counterclockwise, then you're going to bring your knees a little bit apart, and we're going to be doing circles with each leg individually. So you're going to bring your knees up towards your chest. They both go out and then come in towards the center. In, out, and then up. And again, we're doing this about 10 to 12 times. And doing this with your breath, again, the movements should feel nice and easy. As you do this, you might need to start with smaller movements first, and as those hips start to get more mobile, go into deeper, bigger circles. This should feel really good, even on the low back and on those hips. This is getting some great mobility, great blood flow into the hips and into that pelvic floor area. And again, we like to do this with our breath. So breathing out, breathing in as you open up, breathe out as you bring your knees towards you, and breathe out. So again, about 10 to 12 times. You can certainly do it more if it feels good, but we want to do with what our body wants us to do and what feels good for our body. So just work with where you're at on your journey, starting smaller if you need to, and then progressively getting into those bigger, deeper movements. And then the last exercise, you're going to be having either your knees bent, you can have your legs straight out, or you can use a pillow underneath your knees for a little bit of comfort. So with this one, we're not going to be moving our hips, but we're going to be focusing on our pelvic floor. So I'm going to show this first sitting up so you can get a better idea of what we're doing. So we're doing a mobility exercise for the pelvic floor muscles. So you're going to contract the pelvic floor. So you should feel these muscles pulling up and in, almost like you're trying to stop yourself from urinating or stop yourself from passing gas. And then you're going to relax them. And then you're going to gently push out, almost like you're trying to gently, quietly pass gas, and then relax. So you're going to contract for a couple seconds, relax, and then gently push out. You can do this exercise sitting up, but since we're already lying down with those other exercises, we'll do it lying down and really get some relaxation. So I'm going to leave the pelvis here so you can kind of see where we're at with the pelvic floor muscles. And so while you're lying down, or again, if you want to sit up, you can do this as well. You're going to contract, so pull in the pelvic floor. You should feel everything tighten up, and then relax, and then gently push out and relax. Pull in and squeeze, relax, and then gently push out and relax. As you do this, your legs and hips should be nice and relaxed, belly relaxed. We'll do a couple more. You're going to squeeze, let go, push out, relax. Squeeze, pull in, relax, push out, and relax. Squeeze, let go, push out, and relax. And you can do about 5 to 10 of these at a time, so we'll do a couple more. Squeeze, let go, push out, relax. Squeeze, relax, push out, and relax. We'll do one more. Squeeze, let go, push out, and relax. So this really gets some great mobility with those pelvic floor muscles and get some more blood flow in there, just like we did for the hip exercises. If you found this video helpful, please like it and make sure to share it with somebody who needs it. And when you're ready for more deeper stretches for the hips and for the pelvic area, check out my video with a more advanced routine for exercises with pelvic radiation therapy.